Welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone. I'm Lori LeBay, and welcome to Alzheimer's Speaks. We're going to have a great show today. We're going to be talking about oral health and what that means and how important that really is to taking good care of yourself or someone that you might be caring for. But before I introduce you to our guest today, I just want to give a shout out. One, thank you all for your follows, likes, clicks, and shares. We really appreciate it and hope you will continue to be a giver of hope in doing that. It really is very powerful to be able to spread this information to people. So thank you for your time and energy and being part of our community. We really do appreciate it. I also want to give a shout out to Twiddle. I don't know if you're familiar with them, but they have great sensory stimulation aids. They also have a garment called AdaptoWrap, and I highly recommend you check both out. You can go to the number 4 and then twiddlesplural.com for more information on that. And of course, we encourage you to check out Dementia Map, our global resource directory, which is free to use, and you don't have to give us any personal information. We've made it very simple for you. And if you have a service, product, or tool and would like to be part of Dementia Map, we would love to have you join us. Just reach out to me, and I would be more than glad to talk to you about that. And then, of course, we have all our free resources on alzheimersspeaks.com. Just go to our free educational resource tab. So with no further ado, let's introduce you to our guest today. Well, Joy, I am so excited to have you on the show today. I love the work you do, and it's something that is so badly needed to be talked about. And we need more dentists like you out in the world that really understand where our seniors are at and how to care for them at their level with their needs. So I'm going to ask you, if you don't mind, to introduce yourself to our audience.
Thank you so much for having me back, Lori. This is truly an honor and a pleasure. So for those that didn't see me with you before, I'm Dr. Joy Poskozim. I am a dentist in Chicago. I practice 2 days a week in my own office on the north side of the city. Go Cubs. And I also 3 days a week now go into long-term care communities, continuing care communities. I also work with hospice patients. Those that can't come to me, I go to them, and I also make house calls. So I'm not a mobile dentist. I don't have a van. I have a bag for each type of procedure that I do. We do a lot of triage ahead of time with my front desk coordinator to make sure that I'm bringing the right materials, the right supplies, and ideally right free samples so that I can go into the home with the right materials so that I can provide the best dental care for their loved ones. And it's, everything from learning, if there is a financial power of attorney, so in Illinois, we don't use the word conservator, we use the word power of attorney. So financial power of attorney, health, medical power of attorney, who's in charge. It might not be the person that they're living with. It might not be the person who called. So we have to gather all that information ahead of time. And I've been doing this for 15 years. And I go into over 15 homes now, which is amazing. And it's truly been a passion of mine. It is. I have seen a lot of things that, sometimes I feel like I'm taking 2 steps back, but, one resident at a time, one patient at a time. And my new goal is to really bridge the gap between dental offices that are having their patients. We know that the aging population is the biggest growing population, right, in the U.S. Bridging that gap between the dental offices and the charts, the e-charts that we have for them, and then bringing that over by what? Email, fax to the directors of nursing or assistant directors of nursing or executive directors, whoever the power may be, to show what our patients, now your residents, have in their mouths. And I think communication is key, right? Engagement is everything. So that's my new focus and my new goal. And another focus and goal is with my memory care residents to offer free lunch and learns. Specifically, I do it for the caregivers. I really want to start engaging the nurses now too, to make sure they understand dental terminology. What's the difference between a crown and a bridge? What's the difference between a cap and a crown? Is there a difference? Stuff like that, so that there is better, once again, communication and engagement, and not just with, between me and the nurses, but with the families as well, because the families don't always know what's in their loved ones' mouths. And I think that's a really good segue and something for us to talk about.
Well, and I've heard horror stories where people have had dentures and they like couldn't get them out because it was like glued almost in there. It was just horrible, and family felt awful. They never knew,
Yeah.
So yeah, there's a lot of assumptions, and nowadays you can't tell with the way dental work is done too. It makes it very, very difficult for novice people like myself. I remember with me, I wouldn't have known my dad had dentures except when I was in kindergarten. He had to like hand them over to get work done. And then when he got them back, I wanted to bring them to show and tell. I was fascinated by it. But I never would have known my dad had fake teeth, and as an adult, I probably never would have figured that out either if I wouldn't have maybe gone by his bedside and saw them sitting, cleaning in a cup or something. But I mean, how many people do that? So yeah, it is very, very interesting with that. One question I always ask all my guests, Joy, is have you been personally touched in your own family or circle of friends by any form of dementia?
That is a really good question. So I have been very blessed in the fact that no, I have not. However, I got into this field because of my grandmother, and specifically because she was actually lucid. She was beginning to have a little senility. I mean, so when Obama was president, she thought it was still Reagan. We'll let that slide. But at the same time, she knew all of us, was able to participate in conversations, all that. So, but what happened was she needed a new lower partial denture, and I didn't even know this. I had just moved back from being in New York, where I'd gone to school and residency and worked for a year. And my two aunts cornered me and said, her two daughters cornered me at Thanksgiving and was like, look what Graham's eating. She's only eating the Ensure. That's how she feels comfortable in eating. What can we do for her? She's got horrible sciatica going down her right leg. It's really difficult to move her. Can you come to the house? They already had asked their dentist. Like I said, I just moved home that year. So they already had done this prior to me moving back. And if they didn't have me in the family, then who? Who would have made her teeth for her to be able to enjoy Thanksgiving again? And as the story goes, she went to church. The one place she would go was church every Sunday. And there was a senior ladies guild this particular Sunday. And she comes in, and when she talked, she only really saw her lower teeth, which is what I had replaced for her. And she announces to her 120 friends that I make house calls. Yeah, no. This was an I love you, Grandma, Merry Christmas, Happy Grandparents' Day, so on and so forth. Happy birthday gift to you. But 6 families called, and all of them were in one way, shape, or form suffering from one of the dementias. And my career trajectory just went 90 degrees. I mean, I was really focused on doing aesthetics, working on the younger population, helping improve smiles. Guess what? I still do improve smiles. I'm just doing it for an older population, and it has been incredibly rewarding and I think mutually beneficial. I get as much out of it as they do.
Oh, that's cool. It is funny how little things in life just do vroom, drive
Yeah.
you in another direction.
I
And
had no idea this was even a need. Fortunately, now, 25 years later, I graduated in 99. There is definitely They do rounds in dental schools now, and one of the rounds that they do is a week in a nursing home, obviously under the auspices of a supervising dentist professor who goes with them. But I think it's absolutely wonderful that they're doing that now. But back then, it wasn't a thing. It wasn't on their radar. And so I've been just kind of learning as I've been going. And it's, like I said, it's been an incredible experience.
Well, it's interesting too, and I think probably people don't think of this in the equation. But I've known older people who, they don't smile, they don't talk because their teeth are bad, and they pull back and they get more isolated. And isolation is a huge, huge flipping factor when it comes to depression, dementia, with our elders. So improving that can really improve, I believe, their socialization and they're wanting to be part, because you're making them feel better about themselves. And everybody likes a nice smile.
Exactly. Well, and for me and for all dentists, it's not just about the function. Okay, can you eat? Right? We don't want failure to thrive. But there's also an aesthetic factor in there as well. They have to approve their dentures. They want to make sure that it feels like them, it looks like them, that this is their smile when they envision themselves, regardless if they have, memory issues or not. Just making sure that when they look in the mirror, they're happy with what they see. And that's incredibly important to me as well. Yeah, absolutely.
Well, this is going to be a really important factor, and I'll mention some things as I go along here, because my mom, lived with dementia for 30 years, and we struggled really bad with getting her teeth brushed, and we tried all the different things, which I'll bring up as we talk. But then at the end, we had a dentist that was like, we're just going to pull them all. We'll give her a new set of dentures. And it's like, no, you're not doing that. And I was just pushed, but it's free. I don't care if it's free. That's not the point. She will know. Oh, she won't even know they're missing. I'm like, you don't know my mom. You don't know the situation. And, I almost got into a screaming match with him for an hour and a half, because he did not know nor care about my mom's situation. He just wanted that job. And I was so ticked off that he did not understand that she could still feel the difference. And, I had to tell him through stories of how I knew that, because he's like, no, no, no. And so there's just a lot of education on a lot of different levels, because we've all seen other people's dentures in someone else's mouth, in a purse, in someone else's room. And that's not something easy to learn, because it doesn't feel normal if they're going to be new, if you're going to, pull them all out. And that can be something very difficult for a person with dementia to comprehend. So all of that, I think, is really important, what you're talking about, and looking for those little signs. But do you have some tips for people about brushing the teeth and getting resistance? My mom just didn't understand why was somebody shoving a stick in her mouth? That's how she saw it. She did not understand. She was caring for her teeth, which was something that was extremely important to her all her life. And that battle every day, she would be in a bad mood for half a day over brushing her teeth. So I know my mom wasn't the only person out there struggling with this, or staff or family who are trying to help.
Absolutely not. Absolutely not. So one of the things that I did, so I became a fellow with the Special Care Dentistry Association Geriatric Council. And then I also got my CDP. During COVID, I got my certification as a dementia practitioner. One thing you learn in dental school is to make eye contact with your patients, right? This is a person. This is not just a procedure, right? That's number one. And number two is what we learn is tell, show, do, which I'm going to talk about in a minute. But the one thing that I learned that really made a difference to me with earning my CDP was being at eye level. We are equals, and it does not matter. My patient is my patient. My patient is my equal. And so sitting down and facing them and being at eye level instead of bending down to them or being, right up in their face, if they're standing, if anyone is going to be coming at you with anything, what's the first thing you're going to do? You're going to resist. You're going to go back. And that is truly key in helping to promote really good oral care. So the first thing that I learned was follow an action with earning my CDP is follow an activity with another activity. They're already focused on one thing. We want to maintain that focus. So they've had dinner. They're at the dining room table. Have the toothbrush and toothpaste right there. Think outside the box. Brushing teeth does not have to be in the bathroom. Ideally, at dinner time, sundowning hopefully hasn't, come into effect yet. If the person is beginning to sundown, in the Midwest, as the light becomes, it becomes darker sooner. Obviously, that is going to be more effective. So have dinner potentially earlier, and then have the toothbrush, toothpaste in your basin, or even just 2 cups right then and there, so that you're following one activity with another activity. There's no downtime. We all get cranky when we're tired, and there's enough things that we have to do in order to put our loved ones to bed. So by doing that, now it's out of the way. The only thing this person is going to be, drinking right now is water. So achieve it at that time. Or if it's just easier to do it during the day, but, to get them up and over, if they're in their comfy chair. My grandma had her Jennifer convertible comfy chair. She had a hot water bottle underneath her right tush, and her public television, Inspector Perot, her favorite. Life was great. So maybe they have lunch there, right? It's too difficult to move. They're focused on TV. It's where they want to be. Have them eat where they're eating. And then once again, just follow it up with the toothbrush. Have them brush their teeth in their comfy chair. Put a towel around them and just do it there. And then the next thing, if they're not brushing their own teeth anymore, I try to make sure I want to see, even if it's been 3 months, only 3 months since I've seen them, a lot can change in 3 months. So I'm still always going to tell them it's a toothbrush. I'm going to hand it to them. They may hold the toothbrush. I may grab another one. There is still some form of control and, on their part, which is so incredibly important, right? So maybe they're holding a toothbrush and I'm getting another one, and I'm going to do tell, show, do. I am sitting either in front of them or alongside, like you would in a dental office. And then I'm going to say, Sally, I'm going to be brushing your teeth today with this toothbrush. And then I tap on the upper right side on their face. And I'm saying, I'm going to brush the upper right teeth now. And then they will open their mouth for me, or if not, then I am putting my hand in their mouth, obviously gloved. Obviously, I'm wearing a mask, but I'm going to put my finger out and around side out like this. Can't get bit that way. As long as your finger is clicked into the lip, into the cheek, no harm can come to you. And now you're brushing the upper right side. Now you're going to tap the lower. Now I'm going to brush the lower and then do it. By doing tell, show, do, you are preparing them for where this stick, right, is going to be in their mouths. And I have seen wonderful results with this. I am trying to maintain eye contact, but I'm also not going to do any small talk. We are focusing on one thing. We are focusing on brushing. We leave the TV on. That's fine. We don't need to make this a big deal. Okay, now, Sally, I'm going to brush your lower front teeth. I'm going to drop your lower lip. And now I'm brushing their lower teeth. And even if they're clenching, well, when we clench, our lips open so I can see what's going on, right? And if nothing else, I'm getting the outside of their teeth. Something is better than nothing. And it's also really good if even if they are clenching, because you can pull the lip away and check to see if they're swirling, pocketing, hoarding food. They all mean the same thing. Those are all synonyms, to make sure that there's no food left in their mouth. A lot of times you can get it out with the brush or a finger swab. Sometimes people like to use the swabs. I am not a fan of swabs. They don't clean as well. They don't activate the gums at all to get rid of the plaque and the bugs, the poop, the food, which is what plaque is. I'm not a big fan of the swabs. I know hospice is very into swabs. I'm not. That being said, if that is one way to get potential dry mouthwash into their mouths, so be it. But upper right, upper left, lower left. Do the best that you can. Maybe one side's a little bit easier than the other. Don't expect all 4 sides to be equal, and that is okay. And then, if they spit, fantastic. If they're no longer able to spit, then I'm a big fan of the Biotene toothpaste, B as in boy, IOTENE. All the Biotine pot products were created to be swallowed. They're all pH neutral, and it's safe on the tummy no matter what medication they're on, or lack thereof. So the Biotine products, the toothpaste, the mouthwash, and the gel, which I love to use on my lips in the dead of winter, is fantastic because it's petroleum jelly free. We don't really know what petroleum jelly does to our guts. They're doing the long-term research on that, but we're not really sure. So I'm a big fan of the Biotine gel. There's an immediate effect on that. And so if they can no longer swallow, this toothpaste is safe, it's effective, and it's going to be something familiar to them. It's still going to be a very light, gentle mint. And I haven't really had them any complaints about that product. And same thing with mouthwash. If you're looking for a mouthwash that they no longer can spit, the Biotine mouthwash is once again safe and effective. It's not a consumable. You're not going to be drinking a bottle, but it is definitely safe to, if you do a shot of it and, if they forget to spit or if they just automatically swallow because they have liquid in their mouth, it is perfectly safe.
So can they just get that online, this Biotine?
Yeah. Oh, yeah. It's over the counter.
Okay.
It's over the counter. Yeah. So the Biotine mouthwash is going to be everywhere. Your Walmarts, your Walgreens, your CVS's, Target, it's everywhere. The gel and the toothpaste may be easier to find online.
Okay.
But yeah, they're over the counter products.
Okay. Any tricks to get inside? You kind of went the outside.
Yeah, no, and that is really, but when we get to mid stage and end stage, or late stage, it really does become a chore. And like I said, if we can only just get the outside of the teeth, I'm a happy camper. If they are opening their mouth to, if they're using a straw, for example, and they are, drinking water that way, then I'll try really hard to get, what my brush in there to see if I can, see anything to make sure there's nothing on their tongue that potentially can be a choking hazard. But 9 times out of 10, from the research, from research and from my own anecdotal observations, if someone is going to be, like I said, swirling food, it's going to be in their inside cheeks. And I'm so excited. I'm going to be doing research on this with a swallowing specialist next month. I'm so excited. We're going to start doing some research on that to find the why. What mechanism is lost? Is this once again a control issue where they feel like they are in control? They're holding food in their mouth. Are they keeping it for safekeeping? What is the mechanism behind it? We're not sure. We don't know. But yeah, the bottom line is that is a really good time to be looking for food too. So if we are at a stage where the person is no longer, verbal, or loved one is having problems with chewing and swallowing, then if the swallowing specialist hasn't already recommended it, we want to be going on, hooking in. A lot of times too, when you do that, the lower jaw will automatically drop. Mm-hmm. And that way you can check the tongue, you can check the sides of the mouth and make sure there's no excess food remaining after a meal.
I'm trying to look up this guy's name, but there's like a 2-sided brush. Have you heard of that? Mm-hmm. And what are your thoughts on that? Because I'm thinking, you don't want to get bit, but yeah, if you can pull and then do both where it overlaps the tooth.
Mm-hmm. Yeah, there's 2 rows. So basically, to describe the brush, so you have a regular toothbrush with the bristles, right? Instead of being a regular toothbrush with the bristles, we've got a space in the middle. So there's bristles on one side of the brush on one end, and there's bristles on the other side. And there's a space in the middle that you can put on top of the lower teeth, and you bring it around. And then you can do it to the other side. You can do the same thing. You still want to do the tell, show, do. It does make life a lot easier. Sometimes they're going to, potentially bite on it. We're going to have to do a gentle reminder that this is a toothbrush. And this is not a fork, right? Or a spoon that they need to be, this is not something they're going to be eating. But they are very strong. They work very well. I am, 2 thumbs up on them. They do a great job. And so if you look for, I believe it's called, the 2-sided bristle brush or something along those lines, or you can reach out to Lori, or you can reach out to me at the end and I can find it for you and send an email. So we can do that. And we can definitely provide that information for you.
I found it. It's the 3D Pro brush.
There you go. The Pro brush. That's it. Yeah. The 3D Pro Brush, wonderful product. Highly recommend. Can't say enough about. Safe and effective. And, for those of you that may be in the sandwich generation, that you're taking care of a loved one, but you're also taking care of children, it's a really good first brush to use for kids, to make sure that you're getting both the outside and the inside. If all they want to do is just, rinse, brush for, 10 seconds and get out of the bathroom.
Yep. Yep.
It's a great brush for littles too.
I know. And then I was thinking, they have those ones on the finger like you have for a pet, but I'm thinking, you
Yeah.
could get bit really hard, though.
I would not recommend those.
Mhm.
You're absolutely right. I don't recommend those. They are wonderful for pets. They're wonderful for babies, because they don't have a whole lot of strength and force with their jaws just yet. They're still learning. I would not recommend the finger ones for our loved ones who are older. No.
Okay. The other thing that I saw people trying to brush from the back because then it would be more natural. But for a person with dementia, they don't know what's going on at all.
Absolutely. Absolutely. I could not agree with you more. I have seen that too. I have seen images where they have the person, potentially in a wheelchair sitting in the bathroom in front of the mirror. And you've got the home health, person, or, a CNA or a caregiver behind them, holding the mouth open with their thumb and then brushing so they can watch their mouth being brushed.
Mhm.
I truly do not recommend that. We want to be in front of them or alongside. We want to make sure that we are maintaining eye contact. And by doing it from behind, it's a very much a distraction. They don't want that. They don't like that. Once again, it's anecdotal. But yes, I could not agree with you more. You want to be in front or alongside when you're taking care of the mouth.
Well, and it's so important that people don't always understand, and because we take this for granted, but our multisensory connection, that eye contact, that touch, the talk, all of those things matter. And you can lose those things, and in a second, you are a stranger, you are frightening, you are unsafe. And that was a situation my mom kept running into. It was just, we're trying. I'm like, stop trying. Just stop trying. And then I remember, and I don't know what your feelings are, and I think everyone's is going to be different depending on where someone's abilities are. But I remember my mom they sent her out an electric toothbrush. There was no way in heck, and they spent, I'm sure, millions of dollars, the government, sending out everybody in the nursing homes on Medicare and stuff. They got a free electric toothbrush. And I thought, this is asinine because so many people are not going to use this or know how to use this. And, good concept, but in my opinion, really poor delivery in terms of how, who's actually is this going to help? But
I could not agree with you more. And it's really funny. I was part of that study. So Sonicare, before they got bought out by Philips, I was part of that study when I went to NYU for dental school, and I was part of the control group. So I was maintaining my own brushing with my manual toothbrush, but my colleagues, some of my classmates, were actually given a prototype of that Sonicare brush. And that was the biggest complaint for people in their early 20s who are in dental school. It's like, ooh, this vibration, this is so weird. And it's something for all of us to get used to, let alone our elders who may never have had an electric toothbrush before. And all of a sudden we're handing them something that vibrates in their hand, let alone in their mouths. It's making a weird noise. I am very much pro electric toothbrushes for anybody that can deal with it. That being said, for those that are living with one of the dementias, including Alzheimer's, those vibrations are truly it's not helping. It does not make it more efficient. It does not make a better brush. We are going to use the things that they've always learned. They've always learned how to use. We're not going to try to reinvent the wheel, right? So let's say, for example, hey, my mom's always used an electric toothbrush and now she's refusing everything. I don't think she's going to refuse everything. I think she's just beginning to refuse the brush. Now she can, she's super sensitive right now to the electric brush. Go back and get a manual brush, adult size, but get in a manual one. And let's try that. It's not because she's refusing everything. A substitution, going back to the manual brush, and you might get a better result with that.
Well, yeah,
So
because
sometimes they've had one and now we got to go backwards.
because they go back in time, and again,
Exactly. It's what
if
they
they
first
never,
used.
well, and like with the electric brushes, not only they change vibration depending on the button, and so that's confusing. And sometimes they stop, and then it'll start again. And then they have the color lights for too much pressure, too light.
Yes.
So I mean, and now like my grandkids are like, oh yeah, you can put an app on your phone and tell it exactly what you want it to do, and I'm like, that
Yeah.
is not happening at this stage, for
Yeah.
99% of the population. So again, it's knowing your audience. But I even tried to like return the toothbrush, and they wouldn't take it. So then it's
I
like,
believe
okay,
it.
I'm just going to take it because my mom's not going to use it. But I just
I
thought,
will say
what a
there was,
waste of
there
money.
is a purpose for them, right? So they originally were created for people with diabetic neuropathy
Mhm.
and for those with one of the types of arthritis,
Mhm.
right? For people that can no longer get their hand around a narrow, thin brush that potentially they can't even feel in their hand. They put the motor in the hand part so that if for those with that problem, one of those problems, they could feel it. And then all you had to do was just bring it to the mouth and it did the rest of the work. So it truly does serve a purpose. And the research shows over and over, and it's been defended for years. They've stopped doing research on it because the manual toothbrush, technically speaking, only gets rid of 70% of the gunk in the mouth, whereas the electric toothbrush gets rid of 85. Right? We're still, for the rest of us, we're still reliant on flossing. Sorry to say. That being said, the electric toothbrush definitely does serve a purpose. However, for in our older population, sometimes less is more.
Yeah.
Sometimes less is more.
Well, and I don't think we got any information as to why. It was just like,
Well,
you
probably not.
qualify here, and it was like, oh, you got to be kidding me. They're delivering this to everybody. I mean, and that's when they were way more expensive than they are now.
Yeah.
Because I mean, my mom's been gone for 10 years already, and stuff. So like I said, this is really, really helpful information. I wish I would have known that, but I will add in just the story of how I knew my mom would know if something was going on with her teeth, because I think it's something that so many people think that, well, they don't know. They can't comprehend that. I explained to people my mom's smile looked like a rusted chainsaw with fried rice hanging off, because they were chipped, they were missing, they were full of gunk. She still had a beautiful smile. She loved to smile, but they were horrid. And they were horrid because she was so scared of the process. And we tried the brushing, we tried the swabs, we tried the rinses. None of it worked for us. And so as a family, we just decided, quality of life. And so then the dentist approached me and said, she could die from an infection. I'm like, she's going to die. Period. We know that. And no, we don't want her in pain. She doesn't seem to be in pain. And he's like, well, we'll just go in there and we'll pull those teeth and we'll get, we'll get some plates. And I'm like, no. And he's like, she's not going to know. I said, yes, she is. And finally, I explained to him how I knew. My mom used to love going to the Dairy Queen, and we would get her a peanut butter parfait. And that was her favorite until all of a sudden her peanut butter parfait had rocks in it. She didn't know what the nuts were. There were rocks, and she didn't like that. So we switched to blizzards, and blizzards were fine for quite a while until there was gravel in her ice cream. And so then we ended up going over to McDonald's and just getting a hot chocolate, a hot fudge sundae. She knew. She felt. And my mom was so proud of her teeth all of her life. She had a friend when she was young who died in the dental chair, and she was scared to death of the dentist, but she was adamant about having good pearly whites so that she wouldn't have any infections and all of that. And the thought, my thought of her being devastated, feeling that her teeth were gone, I couldn't even imagine that, because in her mind, she still had beautiful pearly whites.
Of course.
And I could not strip her of that. And like I said, it was an hour and a half, pretty much an argument the whole time. And finally, I just went, It is not happening. You don't have my permission. I'm not having this discussion anymore. And you need to get more educated on people living with dementia and what's going on. Because
True.
if you knew in her stage, those would never end up in her mouth lasting. You know, it would be like trying to get a toothbrush back in there again, trying to put those in and get those out to clean. She would not understand that. And it would
No.
be all of that emotional distress and the cost factor. And it could be dangerous for someone else, you know, because I'm sure there's been issues with people putting other people's, you know, products in their mouth and maybe they do or don't fit or, you know, whatever. But I mean, I've seen that happen way too many times.
I can take it one step further. Dentures get lost,
Mm-hmm.
right? Just like you're saying, they're in somebody else's room. It's in maybe a new tenant, right? A new neighbor that they have, and they're not familiar and whatever. They're getting used to their surroundings. They're going into other people's rooms. They want to see, oh, this looks interesting, right? Dentures get lost. So I'm going to throw another thing out there. Ask their dentist if they can copy the denture as is.
Mm-hmm.
So we now have scanning abilities where we can digitally scan the denture. And now we've got a computer file of said denture. And what I do in my office is that per permission, of course, from the family, whoever the powers that be are, I'm like, look, I'm going to take the denture out of the home. I'm going to bring it to my office. My dental assistant is going to scan it. I'm going to review the scan, make sure it's okay. I'm going to bring it back. So between breakfast and lunch, they're not going to have, you know, a denture for maybe an hour, depending on how far away the nursing home is. And I've got 4 that I can think of right now, just off the top of my head. They're only 20 minutes away, right? Takes about 5 to 10 minutes to scan, depending on what kind of denture it is. But if it's an all acrylic denture, so that would be your upper complete denture, your lower complete denture, and any partial dentures that are completely acrylic, no metal. We're not at that stage yet, but completely acrylic. Ask your dentist if a copy of it can be made as is. Why? Because exactly what you're talking about. We try to put something new in their mouths, and this has happened to me several times where they lost the denture. And sometimes I can take the impressions; they're very amenable to it. Those memories kick back, right? That memory mechanism comes back, and so I could take the impressions all day. I hand them the denture to put their new denture in their mouth, and they hand it back to me and say, "No, it's not their denture. It doesn't feel like their 30-year-old denture. Why? Because the teeth are brand spanking new." And then they can't tell me what's wrong with it for me to adjust it to make it feel like their own. So for those of you out there who are, you know, who have loved ones with one of these removable, you know, prostheses or one of these removable dentures, ask your dentist, find out in your neck of the woods if you can find a dentist who can make a copy of it. What I do is we make a copy of it. I don't charge. If it never gets lost, no big deal. We have these, you know, we have these images for the life of the machine, and then I can always transfer them to a new one if necessary, you know, if that one dies or whatever. So we have a backup. The bottom line is, if it gets lost, and I'm going to even go one step further and say when it gets lost, now we've got, you know, we get a phone call. Now we charge the family, but it's a third of the price because I'm not doing anything. I'm sending that image to the lab. The lab makes it as is. I give it back to the loved one. They've been without their denture for maybe, well, it's 5 business days for me with the lab that I use, and I'm in Chicago, right? So it's about 5 business days. And then I can't tell you how many times they're like, Dr. Joy, you found my denture. Or if for those that are nonverbal, I hand it back to them, they put it in their mouths and they go about their business because it feels just like their own. And so I can't stress that enough. Find out, you know, who can do this for you. So you have a copy already made, have a spare. And so that way, you know, if it does get lost, you know, the nursing home calls you, you know, and say, hey, you know, this got lost. Don't worry, I'm bringing another one. You can call the dental office. Hey, can you make another one for me? I have to give that spare now to my mom. So this is new modern technology that is absolutely wonderful. I've been doing it for about a year now. It's absolutely fantastic. And this is something that is going to preserve their smiles, preserve their mouths. You know, they're not going to have failure to thrive. And it's less work for the dentist. And it's also much more economical to do it this way instead of having to go through all the steps and having the lab have to hand make the denture. These are 3D printed.
Now, this should be part of a mandate, as far as I'm concerned, to do that scan, because you're talking prevention, you're reducing costs, over and over, and like you said, that whole quality of life. It's just so much simpler and quicker. I mean, I remember seeing people get the impressions, which is uncomfortable. That big thing, and I'm all so
Yeah. And
stretched
you're
out.
gagging.
Yeah, that's not going to work for somebody like that. So
No.
there's I've never heard of that. That just makes
Yeah, it's really new
so much sense.
technology. Yeah. But I mean, I've got a situation, but you can also still have the situation like this as well. And this is a tough conversation to have, but I'll never forget I made a new complete denture
Mhm.
for someone who was still mobile
Mhm.
but was nonverbal with Alzheimer's. And the daughter had called me and she's like, I really want a new denture made for her. They lost the denture. I'm willing to pay for it. My grandsons won't come see grandma anymore without her teeth. And I want there to still be interaction. I still want her to see her grandchildren. Will you make it? Long story short, I make the denture. I deliver it. It was walking distance. This place is walking distance to my office. So I get there after work and I'm with the caregiver and we're in the dining room. That's where I found them. That's where I'm like, who cares? I hand her the denture. She puts it in her mouth and the caregiver is like, okay, you can go. And I'm like, not going. I want to watch this. So the two of us are sitting there and she's walking around. And at one of the further tables, there was, the balloons that are held by the weights,
Mhm.
the balloons. It was somebody's birthday. She takes it back to me as I think, thank you, right, as payment for my denture. But the problem is that, the caregiver is like, oh my God, we're going to have a problem here. And unfortunately, 3 months later, that denture was lost. And I'm to be honest with you, I'm surprised it lasted 3 months. I mean, they were trying, the community was trying to stay on top of it. I don't blame anybody, except for the fact that, this was 10 years ago. Now, if that denture worked, fantastic. I'm going to take it back, scan it, give it back to her. And then now I've got that image. So when it gets lost, I can have another one made. But another thing too, though, is sometimes, we could do that. We can, make a new denture and, they might not want the denture. And so the tough conversation is, look, I don't, she's not failing to thrive. She's not losing any weight. She's been without it for 2 weeks. By the time that I get called, by the time they find me, and I get over there. And I'm like, sometimes, once again, less is more.
Mhm.
If this person is happy, yeah, you may have a really difficult time, looking at your mom without teeth. But if she's happy, it's just not, she's thriving as is, maybe we just let this go. I'm more than willing to take your money, but at the same time, I also don't want an angry phone call 3 months from now saying that the denture was lost and we need to start all over. And so that's another difficult, conversation to have. The mouth might just be healthier without it. And going back to what you were saying about, removing all the teeth and then, using plates. No, that is not always the best thing to do because that's indirect. You don't have the same signals as when we have our own teeth. And so it's really important in my line of work. And I think I can speak for my colleagues who also make house calls that we do try to save as many teeth as possible, in this day and age, because we really do want to maintain what they have because this is what they're familiar with and this is what is going to prevent a pureed diet.
Well, the other thing that we don't do well in this industry is we try to prop everybody up and make them look pretty so everyone feels comfortable in their presence.
Yeah.
And I did not know. I knew I was doing that, but I didn't know the effect of what that was that I was
Mm.
doing until I went to share a video of my mom that I was so proud of. We did, musician came in to sing with her and it was videoed. And I would meet with a friend of my mom's like once a month, maybe every 2 months at a restaurant. I'd update her how my mom was doing because she could never go see my mom in a nursing home. She just couldn't emotionally handle that. So I would meet with her and I would tell her how things were going. And this time, as I'm like scooting my butt into the seat, I slide this DVD over with this picture of my mom. And this 76-year-old friend at the time screams out at the top of her lungs in the restaurant, yelling at me, She looks horrible. That doesn't even look like your mom. I'm disgusted with you. You told me you were taking good care of her. Look at her. And I was like, just mortified. And I kind of giggled, that nervous giggle. And she kept yelling. And then finally, I just got quiet and I looked at her and I said, thank you, Kay. Thank you. What are you thanking me for? And I said, Kay, because until this moment, I didn't know you don't see what I see. She goes, Lori, she looks horrible. Her hair's not done. Her teeth are erect. She's got no makeup on. She's got a Billy Goat hair on her chin. I mean, she was looking at all of this stuff. Her eyes are bushy. And my mom always had her makeup on and her lipstick and her hair permed. And I said, Kay, what you don't realize is this is a picture of pure joy today.
Mm-hmm.
Pure joy. What are you talking about? Look at her, Lori. That's not pure joy. I said, yes, it is. She's like, Lori, what do you see when you look at that picture? Because I am not seeing joy. And she almost, I don't think she used the word abuse, but she was right there. That's how she felt.
Yeah.
And I said, when I look at this picture, I see a big, beautiful smile. I know it looks like a rusted chainsaw with fried rice hanging off, but it has her big dimples. And I said, she's got her squinty eyes, but you can still see a little glint in them. And, she is happy. I said, when I look at this picture, Kay, I hear my mom giggle. This is what raw joy looks like as things have declined. It's not about outer beauty. It's about inner peace. And her soul, to me, just glows. And we don't teach people the whys behind the decisions. And I think that is horrible. We're so worried that everybody looks okay, because they don't want to get written up. Well, we have to start educating even our quality control from state that comes in of what is care. What truly is care? It's not about being pretty so someone's comfortable. It is about, is the person comfortable? Are they healthy? And we're doing it all backwards. And we're doing a lot of damage in the long run because our staff then don't understand why we're doing this and why we're getting in fights with people. And, I so appreciate your honesty of, I will do this if this is what you want, but less might be better.
Yeah. Sometimes less is more. It's tough.
And
let's preserve what she already has.
Yeah. Yeah.
Now, I will say this. I've had situations where a crown has come off, right? A cap or a crown, they're synonymous. A crown has come off and, they lose the crown, which once again, it happens, right? We can lose that too in our own mouth, in our own lives. So, there's no blame, there's no shame. But, it's a front tooth. And then someone will say, a loved one will say, I know she's gonna, and I'm like, you don't have to say anything more. Cementing something in, for me to take an impression and then to cement something back into their mouth. Absolutely. I will do that because it's part of them. It is what they are familiar with. This is what you're looking at. I can put a new crown on and that actually is good dentistry because now I'm back to protecting that tooth again, right? If there's no decay in that tooth and the crown just came off because the cement died, which happens after 30, 40 years, something's going to give. And it's usually the cement. So for me to cement a crown back on a tooth, for me to make a new one for them, absolutely. Once again, it's a third of the price because the prep is already there. All I have to do is take an impression. The lab does the rest of the work. That I will have no problem doing to get their smile back, right? Absolutely. It's the removable prostheses, it's the dentures that I really struggle with because once again, this is something that the staff has to be aware of. Oh, now she's got her denture again. Okay, we have to make sure. And a lot of them, what I've noticed, and I'm probably overgeneralizing, but unless the caregiver has had their own personal experience with dental or denture issues, they've had a loved one with their own dental or denture issues, or if they've had a former resident with the same, then they don't know what they don't know. They don't know what they're looking at. They don't know what they're supposed to be doing. And most importantly, they're afraid of getting bit. Mm-hmm. I get it. I get all three things. So now we've got this, we've got our loved one where all the teeth have been removed. Now they've got these dentures. Okay, home, you take care of her now. Well, that might not be the easiest thing in the world to do when we've got sundowning, we've got, the requirement of going into the mouth and taking them in and out. And then, one day they might remember they have dentures and all of a sudden the next day they don't. And what are you doing to me? And why? And that's heartbreaking for me. That's absolutely heartbreaking. So, okay. So I have one patient right now who's got 3 teeth on top. His name is Homer. I love him to pieces. My Homer. He's a great guy. He's got 3 teeth on top. And you know what? That's okay because he's eating well. And I'm so happy for him. And he smiles all the time. So, we're going to let it go. And fortunately, the family gets it and they're okay with that. And this is how it's going to be. And I tell them, and this is the true story. If this was my mom or my dad, I'm the eldest, right? And I'm also medical power of attorney. And this is my mom or my dad. I'd be, telling my siblings the same thing. This is how it's going to go. This is what dad would want. Dad's fine. Dad's eating well. We're leaving things alone. Let sleeping dogs lie. Nothing in his mouth is going to kill him. I'm on it, right? Let him be. He's eating his hot dogs. He's a happy guy.
Yep. Well, and to me, it really does get down to that quality of life. And
yeah.
And because you don't know how it's going to go. Oh my gosh, time's just flying by. How do people find a dentist to come to them?
That is a great question. So what you can do is get online to specialcaredentistry.association.org. So it's going to be scdaonline.org is their website, scdaonline.org. And you can go look into find a dentist. You can do it by zip code. You can do it by city. And then you will get a list of dentists that make house calls or a mobile dentist like me. You can also find hygienists. In certain states, you've got expanded function hygienists that have had the proper training that can go into homes unsupervised. I believe Arizona is one of them. That's the first one I can think of right now. But depending on what state you're in, you may not need a dentist to come into the home. It might be a dental hygienist. So definitely look into that. That is one way of doing it. Another way is by contacting the state dental society. So for Illinois, it would be the Illinois Dental Society or isds.org. So depending on what state you're in, you can also go by that. And they should have a list of dentists that will be willing and eager to come to the home or at least be able to provide a resource. You contact them and through them, they can mention somebody else. And we get a lot of phone calls from the Illinois state saying, hey, will you go into this neck of the woods? Because, Illinois, like any other state, it's a big state, can you help this person out? Absolutely. Let's find someone for them. So depending on how, rural you are or in a big city, the Special Care Dentistry Association online.org is a wonderful resource to be able to find other dentists. And then, I don't know, Dementia Map, maybe?
You are our only dentist.
You're right kidding.
Now. No.
Oh, I'm going to get more people on there, Lori. That's my fault. I'm on it.
Yep. No, I've tried. I know people are busy and we don't input people. We want them to be in control so that they know what their profiles and stuff are. But yeah, we would love to get more dentists.
All right. I'm on it. I'll see what I can do.
And even training classes and things like that for colleges, because families will bring that information, out to their doctors, out to the communities people are living at as well. And, maybe get some extra potential just in terms of letting their kids know or their grandkids know that this is something, this is a field that they could go into. Can you explain really quickly the difference? You said you're a mobile dentist, but then there's
I'm a house call dentist. So a house call dentist, I drive up, I have my bags, I go into the home, boots on the ground. So I will see the homebound patients.
Okay.
So a mobile van will pull up outside of a community, let's say, and then the caregivers will bring the patients or their residents out to the van to be seen.
Okay.
That is the difference. So I am treating a lot of memory care and hospice and skilled nursing patients because they can't do that. They are bed bound or wheelchair bound. And I want to practice. I want to be able to provide care in the place that they feel the most comfortable. I get the most leeway that way. And it may take us watching Fred Astaire on MGM for 20 minutes before they'll let me look in their mouth. But, whatever it takes, this is their home. I am their guest. I am being invited in. And that's the most important thing for me is me going in. So I will never have a mobile van. I'm not going to make that investment because that will completely change my type of practice.
Yeah.
And that is me being on their turf.
Yeah.
And that's really important to me.
Well, and I think it's important to a lot of people too,
Sure.
to be able to do that. Well, Joy, this has just been absolutely fantastic. Well, we'll have to have you come back and talk on some other things. I know that there's so much going on in your industry and the work that you do. I'm a firm believer in it. I think we need a lot more knowledge. And we need more families knowing that these are even options.
If I can say one more thing, as your loved one gets older, go with them to the dental office. Make an excuse. Hey, I'll take out to lunch afterwards. Let's go out to lunch beforehand. Even if you're sitting in the waiting room, try to be with them. Know who their dentist is. So even if you never even know what's in their mouths, that way you make that connection so that if your loved one is having to move or even choosing to stay in place, you can make that bridge. You can create that, that continuity of care from what the dentist has been doing for them and what you now can do for them or what the community that they're moving into can do for them.
Okay, wonderful. Great advice. Gosh, this has just been a really packed well show.
I know.
It's filled with information. So again, thank you so much for spending this time with us and giving us such great advice and insights there. For all of those listening, again, we've been talking with Dr. Joy, and what a fantastic dentist she is. I really wish I would have known her when my mom was going through all this. Even though I'm in Minnesota, I could have maybe hooked up with somebody here locally that could have helped us in a much better fashion. You can go to her website. She has a couple of them. You can go to joyposkozimdds.com. She's on LinkedIn, Instagram, Pinterest, and then you can also go to her joyfuldentalcare.com site if you want to book an appointment. And she's also on Facebook, and we'll have all of this contact information in the notes for you. I highly recommend that you check these out, or maybe you're a community or an educator and you're looking for someone to talk on this. Reach out to Joy. I'm sure she would be more than glad to do that. She's, as you can tell, she's passionate. She's on top of what's going on, and she really understands the whys. And to me, the whys are critical in terms of how we serve and why we serve. And you can tell her heart is just laid out there, trying to do the best she can for our elders. So I hope you'll all be a giver of hope. Like, click, and share. Again, for me, it's not about the clicks. That's not what I'm chasing. I still believe word of mouth is the most powerful way to communicate. And there are people in your sphere of influences that need this information that don't even know this exists. And, this is the best way to spread the word and to empower everybody to get better connected so that we can all live a better life. So again, thank you so much, Dr. Joy. This has just been fantastic. I appreciate your time. I do want to add one more plug, though. Joy writes excellent articles. She's been writing like an article a month for us on Dementia Map. So you can find her at dementiamap.com. As well. But if you go to our blog section and search for her, you will see her articles are just now popping up. She's got them all lined up for a whole year or so, and I've read them ahead of time, and they're really comprehensive and yet light and easy, but packed full of information like this show was. So again, thank you, Dr. Joy.
Thank you. It's my pleasure.
So last, I'm just going to remind you again, please check out dementiamap.com as well as alzheimersspeaks.com. Both are filled with wonderful resources for your caring journey for anyone with dementia, but you'll find a lot of stuff that's just good for all of us there as well. Thanks now. Bye-bye.
Attention seniors, Are you looking for a community that offers incredible benefits and stands up for your values? Look no further than AMAC. With an AMAC membership, you'll enjoy exclusive discounts on insurance, travel, dining, and shopping. Stay informed with 6 issues a year of our award-winning AMAC magazine, delivering trusted news and valuable insights. But that's not all. AMAC is committed to defending America's future by directly bringing the voices of our more than 2 million members to our elected officials. Join a community that cares about your needs and your values. For a limited time, we're offering a 1-year membership for only $1. Yes, just $1 for a year of incredible benefits and advocacy. Don't wait. Take advantage of this special offer and join AMAC today. Visit amac.us/join now. That's amac.us/join now.